afternoon. Thank you for being here with us this afternoon for our panel regarding maternal mental health. My name is Margaret Fulmer, and I am a Utah area humanitarian specialist for the Church of Jesus Christ of Latter-day Saints. But before this role, I worked at the state as an outreach specialist into faith-based communities regarding maternal mental health. And that's why I was asked to host this panel, and I feel very privileged to be here with these panelists. I want to just take a minute and kind of set the frame for you. First, maternal mental health is how a woman feels physically and emotionally, and well, mentally and emotionally, I should say, from conception to year after childbirth. And what it is not is a character flaw. And that I just want to put that out there, and so that we have the proper framework as we talk and think about this. In Utah and nationally, mental health issues and substance abuse issues are the top cause of death among women during this period. And many people are unaware of that. The good news is that it's preventable. And the other good news is all of you sitting here today are faith communities. You are an important touch point, as Carl highlighted so well. You are an important touch point for families and individuals and mothers, and you can make a difference. And so I'm so excited to be here. We have three fantastic panelists who each have a lived experience that I feel will really help you understand this issue from a better perspective, their unique perspective, and hopefully that when you leave today, you'll have an idea of what maybe you could do, one thing even, to help with this important issue. So first, I would like to change my card so I don't mess up the names. We have Megan Johnson, and she is the co-founder of the Emily Effect. And then we have Dr. Hunter LaCouture. Did I say that right? He's a resident physician at the U of U School of Medicine. And then Courtney Fletcher, she's a behavioral health specialist at Primary Children's. So please welcome our panelists at this time. So they are each going to take a few minutes and just introduce themselves and tell you a little bit about them and why they're here, their story. And then after that, we'll jump into the panel discussion.
All right, well, I am so grateful to be here. This is such an amazing opportunity for people to get together from a faith-based perspective. I can tell that this is just going to be such a valuable experience for all of us. So again, my name is Megan Johnson, and I am the co-founder of the Emily Effect Foundation. And the Emily Effect honors my sister, Emily Dykes, who passed away from complications of postpartum anxiety back in 2016. And before I tell you a little bit about her story, I want to tell you about her. Emily was 7 years older than me, and growing up, she was my idol. I wanted to be just like her. She was talented, beautiful. She was an incredible mother. She was kind, and she drew people in, and everybody who met her, she made an impact on them simply because she was thoughtful, intentional, and kind. After having her fifth baby, Emily experienced some postpartum anxiety. There were some complications during her delivery, and soon after she came home from the hospital, we noticed that things were different than her previous babies. Her anxiety was really heightened. She struggled with nursing. She couldn't sleep. She struggled to get on top of it and to manage it. And we went through a lot of ups and downs with her for a year in dealing with this anxiety. A couple times going to the ER, trying to find the right medications, right therapists who were trained in maternal mental health, even experienced a hospitalization a couple weeks before she passed away. It was a really hard year for our family. It was something that we had never experienced on this level, and it was a struggle to find the right resources and get her the right help. On the day that she passed, she was struggling again, and she was with my father. They were riding on the freeway on I-15 north of Nephi, and she experienced a panic attack. and she had this panic attack. She tried to get out of the car, and my dad was pulling over, trying to hold her in, but as he pulled over, she was able to get out of the car and ran up the freeway in this panicked and disoriented state and was in an auto pedestrian accident. And because of this, her story was very public. And we had to decide as a family what we were going to do about sharing her story. And her husband, who I'm so grateful for and has been, had such a great vision for the work that we've done. He said immediately, and we all agreed that we needed to share her story. Emily was somebody that, looking, from the outside in, you couldn't have imagined that something like this could have happened to her. And we didn't want to hide what had happened to her. There's no shame in it. And we knew that a lot of other moms also struggle, and that we needed to share her story to help them feel less shame in their stories, as well as use her story to improve resources. So that's what we've been doing for the last, it's been almost 10 years now. And it's been very helpful for our family to share her story and connect with other people on this topic.
Thank you, Megan.
Yeah, thank you very much. My name is Hunter Locator. I'm ecstatic to be here. I'm just going to put it out there. There's like an 80% chance that I cry during this, so apologies in advance. See, here it is. Okay, here we go. I even practiced this. I appreciate the introduction. I am here because I lost my wife, Lauren, to suicide 5 months after our baby Stella was born in 2020. Well, she was born in 2023, and Lauren passed May of 2024. I want to talk a little bit about Lauren, though. Lauren was, again, similar to what Megan shared, just a ball of energy. She was 5'3". She lit up the room. She had a smile. Her teeth were as white as the clouds. She was aggressively kind to people. She was charismatic as all get out. She was talented, frustratingly talented. She could land a backflip on skis as a junior in high school, which still to this day I've never been able to do. She ran track in college. She was social. And while she was growing up, she always had an aspect of anxiety in her life that she always managed very effectively with exercise, with diet, with being social, with spirituality. And she didn't really hit a point where it became significant until she was serving an LDS mission in Italy. And she had an experience of, anxiety, depression, kind of a mix of both, where it inhibited her ability to function on a day-to-day basis. So she returned home early and did all the appropriate things. She went to therapy. She got on medications. She continued to exercise. She went on to continue her track career in college. And, for the next 7 or 8 years, that's when Lauren and I were, dated and were married. She had, a pretty stable life. There would be about 1 or 2 episodes per year where she'd get kind of smacked with an episode of depression, the type of depression that puts you in bed for the whole week. But outside of that, she was stable and lived a fantastically normal life, and not just normal, but exquisite. And we found out that Lauren was pregnant with our baby Stella a couple months before we moved to North Carolina for my surgery residency in North Carolina. So we moved across the country. We didn't have any family out there, and we were ecstatic. Stella was born in December of 2023. Everything was amazing. That being said, we knew that Lauren was higher risk for maybe experiencing postpartum blues, postpartum depression, and so we were on high alert. And so after Stella was born, we sought out maternal mental health specialists. She saw a nurse practitioner that was fantastic, followed up with her OBGYN. She continued to exercise and be social and, all the right things. And about 3 months postpartum, she started to, that anxiety and depression started to creep in despite all of those things that she was doing, all the right things. And it was a gradual progression of sort of spiraling thoughts about, seemingly normal things. And it didn't look like her previous episodes of depression where she just sit in bed all day. She was doing all the things, but struggling on the inside. And then when Stella was 5 months old, I was at sorry. I was at work, and she experienced an episode of postpartum psychosis, or at least that's what it appears to be. No one was with her, and took her own life. So now I took a year off of residency, moved to the University of Utah for residency. So that's where I'm continuing, and I'm happy to talk about all this. I'm ecstatic to be here. So thank you for having us.
You, Hunter.
Hi, I'm Courtney Fletcher. I work as a behavioral health specialist with Primary Children's Intake Crisis Unit. And I want to say that I appreciate your guys' stories and postpartum for moms, and I think anyone in general is just really rough. I have 3 kids total, and I did lose one. And this was about 7 years ago, and I was 24 weeks pregnant. A lot of complications were happening. I went to a maternal fetal. Is that better? Sorry. Thank you for telling me. I went to multiple maternal fetal specialists for complications during my pregnancy from like 8 weeks to 23 and a half weeks. There was a lot of things they couldn't help me with, so I ended up having my son and then losing him after a day. With that being said, like the postpartum with that was extremely hard to go through versus my other kids' postpartum, right? Everybody has it differently, even yourself versus the kids you have. My first, I didn't have postpartum at all. My second was, I was in denial with it, and it took about a year and a half for me to understand I was not okay. I wasn't myself. And then when I lost my son, my third one, it was more of a, I don't know if I'm gonna be able to get through this. I don't know if I'm gonna be able to handle this. How am I gonna be a mom to my other 2 when I just lost another one? 6 months after that, I ended up getting pregnant with my daughter, and super complicated with that one. And then I had her at 28 weeks. She was in the NICU for about 94 days. She's a fighter. She's now 6 years old, just turned 6 a couple days ago. But I didn't feel normal. I didn't feel okay. I didn't feel like I should be here. I didn't feel like I should have lost him. I think that, I felt like I couldn't help him in any which way. I felt useless. With that being said, I didn't turn in many directions with my meds, with anything else that was suppressing all my feelings, and I could not suppress what I was feeling. It made me feel like a zombie, and if I didn't go through the pain and the feelings and emotions I needed to go through in that moment, I don't think I could have been a mom to my daughter coming in, or processing the fact that I was having more complications with another child. So with that being said, I think the postpartum is just really hard for everybody, and if we can find out certain, can't say trigger really because you don't know. You can't, if you can look at someone and just say, you know what, you don't seem like yourself, just try to be there for them, like in any way possible. Words, hugs, like just support in any way, shape, or form. Thank you for letting me be up here. I appreciate the opportunity.
Thank you, Courtney. And it is challenging to share personal stories, sometimes just with family members, but with a whole group, you can imagine. So I appreciate you being here and having the courage to do that. I'm going to start with just a few warm-up questions. I'm going to open it up to all of you. And the first one is, and you don't have to answer everyone if you don't feel like it, but I'll just share what helped you first recognize that something wasn't right or that support was needed for yourself or your loved one.
Well, as I mentioned a little bit with Emily, it was just so different than her previous pregnancies. She had had baby blues, even like struggled a little bit with anxiety, but I think it was that it was kind of a fixation on things and then not being able to let go. And then when it turned into like the sleepless nights and just being able to like talk her through things, it was so different because a lot of times when these kind of things happen, like we can talk with somebody and we can kind of work through and kind of come to solutions, but those normal things that you do in those situations just weren't working like they used to. And it just became, tricky for our family because it was something that we hadn't experienced before. They were good about getting help. She talked to her OB, therapy. And I want to mention that, like, she had pockets of good help throughout that year, but it was just kind of disjointed and sometimes hard to have everybody connect with each other and be on the same page, that kind of thing. But I think the biggest thing to recognize is when someone's not themselves and when they're not functioning at a level that they normally function at.
Perfect. Thanks.
Yeah, I think similarly, I've done a lot of thinking about this. Right after the incident, I thought there were no signs. I had no idea. Right. I lived with her. I was acutely aware of what she was thinking and feeling. I think now, though, I've done a lot of thinking about this. Lauren also was having sleepless nights to the point where she was, running on fumes every single day. And what that turned into was these hopeless loops, like spiraling loops, where I'd be gone for a day, a full day of work. In the morning, everything was fine and dandy, and I'd come home and she'd want to move houses or like some drastic measure to grasp for something else, something better, or she'd want to leave the church that we were in, or she'd want to go fully back in because we were sort of in a transition state, or she'd want a divorce, but then 2 hours later she'd want to be, it was completely the opposite. I think, but ultimately, the sign that I look back on is Lauren's motherly guilt. She's the best mom, but felt like Stella didn't deserve her as a mom. That's where, like, she would end up. She would struggle, and then would think, I don't want to have more kids because Stella doesn't deserve me as a mom, and I don't deserve her. That's sort of what I can think of. So maybe a sign.
I think you're right with that one. I didn't feel like my kids deserved where I was at. I wasn't mentally okay. But you kind of live on autopilot. You're there, but you're not there. And I think it's just really hard. Sometimes you can't see the signs. You see that they're kind of just there.
Such good insights. I hope everyone is taking notes on that. If you wouldn't mind, what made it difficult to reach out for help or to feel heard at that time for you?
It's a great question. I didn't reach out to anybody when I was going through what I was going through. I kept that to myself. Went through the struggle by myself. The day of me going into labor, I ended up calling my sister and just said, "Can you watch the two boys while I'm here?" I didn't think that I needed anybody's sympathy. I didn't want the pityness. I didn't want people to look at me like I was the problem. I felt like I did everything I could, but I did feel like I wasn't doing enough to keep him. It's out of our hands, but in the moment you feel like you just lost everything, and that was my fault,
Yeah, that guilt that just creeps in. And Hunter, you hinted at that.
Yeah.
Megan, I'm gonna bring this to you. Sometimes people don't know what to look for, and you've touched on some of these signs. So I think, and I feel like sometimes as faith leaders, we don't know what we're seeing. So it could be right before our eyes, and we're not really able to interpret it. So what signs might friends, family members, and faith leaders notice when a mother or a parent would be struggling with their mental health? And you kind of touched on that, but maybe you could just go into a little more detail.
Yeah, I think it's important to understand what postpartum mood disorders look like, or perinatal mood and anxiety disorders. And oftentimes we think it looks like a mom who can't get out of bed and who's just struggling and not functioning. But there's a spectrum, and especially clinically, we have, postpartum OCD, psychosis, PTSD, anxiety, all of these different aspects. So that's the first and most important thing to consider, and especially to educate yourselves, your loved ones, about those things and those warning signs. But I would say the biggest thing to recognize is that it's often the moms that we don't think are struggling the R, because it doesn't, these moms are actually oftentimes high functioning, but it's just that it's taking everything out of them to function. And as has been said already, just noticing when somebody isn't like themselves, things are just a little bit off. Obviously, there's these additional symptoms like clinically that if you really want to educate yourself, but that's just a good indicator to start with. And that's why we ask the questions, right? And not assuming that everybody is okay, and that's why we develop relationships. That's why when we have a new mom in our congregation or a sister or a family friend, that when we talk to them after they've had this baby, that we're taking them aside sometimes and saying, like, how are you really doing? Or how, I struggled in this way, or this thing was really hard. Like, I think the way that we talk before and during these really crucial periods of time can really set the stage by educating and awareness, but also by creating a safe place and relationships to where we can understand and that these things might come out more.
Such good insights. And so don't be afraid to leaning into
Yeah.
some of those impressions and just reaching out. Hunter, I'm going to ask you this one. Many parents, especially mothers, hesitate to ask for help because of fear or shame. And we heard Courtney talk a little bit about that. How can, if from your perspective, how do you feel faith communities could use their words, actions, or even traditions to create an atmosphere where parents and moms are comfortable reaching out for help?
It's a great question. I've done a lot of thinking about what people can do in a community, faith community, neighborhood, spouses, what we can do and to foster a community or a setting where that shame is stripped. And I've thought of a couple different things. Number one is the words we use. The words we use, especially in faith communities, I think it's important to really emphasize the fact that seeking help is not a sign of weakness. And I think deep down we all know that, but I don't know how much those words are said over a pulpit or in a Sunday school class or at a youth activity, that struggling and asking for help is a sign of faith and a sign of strength. And the more we get comfortable talking about our own struggles and everyone else's struggles in like on a large platform, it creates that environment. I think the next thing is I think there's a tendency with faith to think that righteousness equals happiness, and that it's not a linear relationship like that. You can be very righteous and very miserable, and vice versa. And I think then that sort of kind of goes along with the language we use. But I think this is the other side of this is practical help. Knowing, like, churches and hospitals and schools are all catch nets for warning signs for people that are struggling, whether it's abuse or whether it's suicidality. And as people as leaders, people of positions in leadership, it's important to know what to do when we notice those signs, who to call, how to approach the situation, what resources we can give, and how to actually approach that individual and say, hey, I'm noticing these things. Are you struggling? And or say, I struggled with, like what Megan was saying, you can sit with them in their grief. And you may not need to offer any resources at all. But I think having that knowledge of what to do in a situation like that, along with the language, helps.
Thank you. That's such good insights. I want to just pause here for a moment and open it up to you, the faith leaders in the audience, if there are any questions that you would like to ask. I think there's a mic that could go around. Oh yeah, we have it there in the back. Wondering if any of you have questions you would like at this time to ask our panelists about how to help someone struggling, how to lean into that discomfort, and maybe even how to have those conversations that Hunter was talking about.
I'd like to know more about what the medical field is doing as far as the doctors that prospective mothers visit and what type of resources are being offered from those offices.
Well, I feel like I can speak to that a little bit. Just since Emily's experience, we were just able to really be connected to people who were already in this space trying to improve resources and screening. And I think Emily's story just kind of poured fuel on the fire, because when it's somebody that we know and love, we pay more attention. So some of the cool changes that I've seen happen over the last 10 years is that women are being screened more at their prenatal appointments, at every appointment. Also their postpartum appointment, but they only have one of those. And so they're actually being screened at their pediatrician appointments with their babies as well. They just have a screening they can ask every time. And I think the more that those questions are being asked, number one, it like normalizes it, but it's also helping those conversations to take place a little bit more naturally when it's happening so often. And I've also seen an increase in resources for moms, specific places that they can go, therapists who are trained, and a lot of OBGYN offices are also bringing in mental health professionals as part of their care team as well, so that they can coordinate care. So there are, Hunter and I were just talking about, it's tricky with our stories because our families are doing the things that we were supposed to be doing, right? And our stories didn't end the way that we all want these stories to end. But I want to give you reassurance that we're going in the right direction and that there are better resources, and we still need to encourage our loved ones and those in our communities to get the help, because it's getting better.
No, agreed. Just to add to that, Lauren, I think, screened high enough on her like risk scale at her OBGYN and was given resources for a maternal mental health nurse practitioner that was, not in the OBGYN office, because a lot of these OBGYNs, they see so many patients, they can't sit down with you for an hour and talk about, mental health, but she was referred, and it was very slick, actually. It was very nice.
And I just wanted to add, at my previous role at the state, some of our outreach, we have strong outreach efforts into clinics across the state, trying to educate physicians, OBGYNs on this issue and how to screen and to implement those screenings. So that's a great question. Thank you for asking that.
Is it on? Okay. Question on, just kind of curious on maybe percentages is hormonal imbalances, the chemical imbalances, or versus, mental challenges. I mean, I'm sure it blends together, but what's the percentage of what that imbalance is going on?
If I knew that answer, I probably wouldn't have a job anymore. I don't know. And I think it's a very nuanced, it's almost impossible to answer. Because every woman's situation is different. I do know that the spike and drop of hormone levels throughout the perinatal period is the single biggest swing in hormones that we have as humans. And so that can't be neglected, right? And then there's an aspect of medications, and then there's aspect of food and exercise and life stressors and previous mental illness. Lauren was switching medications actively postpartum because nothing else was working. And even with that, there are some medications that have black box warnings for increased suicidality within 2 to 4 weeks. And I can't say that didn't play a part in Lauren's episode of psychosis. It's hard to say.
I didn't mention I'm actually a therapist as well. I probably should have mentioned that. And I've also experienced regular bouts of my own depression and anxiety. So this is kind of my world that I think about a lot. But the answer to that question is nuance. And I think what we can do better as leaders and family members is help our loved ones to understand what's happening during this period. Like the chemical changes and the hormonal changes that are happening in a woman's body, both during pregnancy and especially those first few weeks after. There's no other human experience to where the hormonal shifts and the brain chemistry changes as much as it does. On top of losing sleep, on top of having this new baby and huge life change, all of these things. And I was going to mention earlier when we were talking about how we as faith leaders can be better about creating awareness and the things that we need to understand. And a lot of women aren't getting help because, number one, they feel shame. And part of the reason they feel shame is they don't understand what's happening to them. And when you explain it the way that I just explained it, of all of these changes, there's reasons why women are experiencing all these things. There's even more factors than I've even mentioned, but that shifts the perspective from I'm a bad mom. And we idealize motherhood, especially I think in our faith communities. Like rightfully so, but also like I think we need to be careful about how we teach and have conversations so that like the mom that's not having the experience of like I feel so connected to my baby or I love motherhood right now, like I think in our congregations we can facilitate conversations, or in our one-on-one conversations we can facilitate conversations that say, you know what, like it doesn't always feel that way, or this is hard. And so I think we can educate them, but also we can change the conversation around idealizing motherhood and letting us all be transparent and real and being real in those conversations with them too.
Perfect. Thank you. So I'm hearing more conversations, open conversations. I've heard faith leaders maybe leading out with their own stories, kind of enabling that conversation to take place. There are medical factors. Something I didn't hear that I'd like to add is the reality of sleep deprivation on the brain. It's just huge. And that is a given with a new baby. And I see women shaking their heads. And so I think just remembering that, and from a practical standpoint, is there some way that a faith community could help with that? So I would like to shift a little bit now to a little bit of hope and healing. And Courtney, I have a question for you. It is hard to find healing and hope after tragedy. And usually it takes time. And you talked a little bit about that. For you, what types of support, so either spiritual, emotional, or practical, made the biggest difference in helping strengthen your hope and healing over time?
I think honestly, just putting hope into my kids and myself, there wasn't really much I was looking towards. I journaled every day. I wrote down every moment I could possibly think of the days that had led down to everything. Just family and family support, really. You know, my sister was there. I didn't really look towards anything. I just felt alone. So alone. Sorry.
No, that's good. Anyone want to add to that from the panel?
I have a small thought that was already kind of touched on in the morning session. The thought of companionship, sitting through grief. Like sometimes when you're sitting through grief, it feels like you're in a puddle of mud and you're alone. And sometimes all you need is someone to just come sit in that puddle of mud, not try to sweep up the mud, not try to change it. And in the morning session, I think the term companionship was used. I like the word or the term grief buddy. It's like they're not trying to fix anything; they're just sitting in the mud with you. And sometimes that's all we can do and all we should do.
That's such a good insight. And I think the temptation is wanting to fix it and wanting to do something. But what I hear you saying is just simply your presence is healing. So, okay. So finally, I'd like to open this to the whole panel. And that is, how have you found meaning or purpose or even an increase in your faith through your experience?
I think I found more faith just because I was so alone through all of it that when it came down to me going through another struggle with my daughter, I had more support. I had more people around me. I had better things to look forward to. I never trust people with my kids. I was the worst person to, leave my kids at daycare or babysitters or even family members. But when it came down to the support of the NICU and every nurse that took care of my daughter, knowing she was in great hands, just my faith was in their hands. Just everything about them taking care of her, knowing I wasn't going to lose another child.
That's a powerful insight. Thank you.
I love this question, and it's a very loaded question, so I will try to be concise. But I think the biggest thing for me that has helped me to heal the most is having opportunities to help others heal. And I've learned that we go through these hard things so that we can then gain the knowledge and experience and empathy that we need to help other people on their journeys. And I think that that's God's plan. I think that that was very intentional, and that He uses us to help each other heal in that process. And then also in that process, we experience our own healing. And so I would encourage you that with your community members and your loved ones, that you watch for those moments when they are ready to have that conversation, when they're ready to explore what is the purpose in this, how can I do good with what I have learned, and be intentional and be prayerful and discernment about when those times are, and to seek for opportunities to have those conversations, but when they're ready is the key with that. But I truly have experienced healing in having these opportunities to help other people heal. And it doesn't mean you have to start a foundation. It doesn't mean you have to be very public about it. Like, some of my most sweet and healing experiences have been in those one-on-one conversations. And also for me, like, my faith and having such a deeply painful and tragic experience has also expanded my capacity not only to feel heartache and grief and all the things that come along with it, but also expanded my capacity to feel joy. And for me, that has come through my relationship with my Heavenly Father and my Savior, Jesus Christ. And I'm grateful for the opportunity that my heartache has given me to experience them. I wouldn't trade it for anything. And I think if we can help people when they're ready to turn to those things, and to have those kind of experiences, when you have that, it's something that I can't put into words to be able to experience that kind of love and kind of healing. But we have to understand where people are at and their experiences and their faith to help them along that journey. And sometimes, as has been beautifully said, it's just sitting them with it in it and understanding it. And then from there, I think we'll know how to help them better.
Such good insights. Did you have something to add?
Yeah. I mean, preface here, I'm still very much in the thick of my grief, so I don't have a good answer here. But to add to what's being said, I bet you if each one of you thought about the people that you interact with in your families, at work, in your neighborhood, in your congregations, you can probably think of more than 4 or 5 people that are going through a perinatal period and likely struggling with the things that we're talking about. You may not see it on the surface, and no one saw it on Lauren's surface except for maybe me and a handful of other people and her therapist. But even people outside of the perinatal period are around us everywhere. And I think to be keeping that in mind, like the person that I'm talking to right now may be having suicidal thoughts right now. Maybe they will tonight. Maybe they did yesterday. Maybe their hormones are so whacked they've never even felt this way before. And I think that while I'm still in my grief, has taught me to be more aware and empathetic.
The numbers support that thought, by the way. So I'm going to open this up. I want to end kind of in a prevention sort of mindset or an action sort of mindset. So I'm going to open this up to all of you. What type of faith-based or community response do you wish had existed when you were struggling? And how might the people here today help start build that? So it's kind of a 2-part question. What would have helped, or what could have helped, and maybe how would you start that? Faith-based or community?
I would say community-wise, for me, it would be, you only get so many doctor visits. They're busy with all the other patients. They got so much going on. You can't call and just ask questions because you have to talk to a nurse. So, like, someone who's on call, you got the prevention suicide hotlines. You got so many hotlines. There should be something for women too, with hormonal imbalances, prenatal issues, just straight up pregnancy hormones, before, after, in between, because not all of us want to open up to family. Not all of us want to open up to the community or our religious beliefs. Like, I didn't want to open up to my work. And the one time I did, they gave me the most amazing blessing. And I felt so loved that I felt like everything was just going to cure everything. But I just wish that I had someone I could just talk to that could help me in the moments I needed.
That makes a lot of sense. Go ahead. Do you have a comment, or Megan?
I think this. I wish that there was a better. I think that this exists, but I wish there was a better connection between community programs like churches, healthcare, like through physicians, therapists, and then through and sort of therapists and the mental health side, because I think that the doctor side is very separate from the therapist and mental health side. I wish that there was a better connection between the three. And I think that maybe an actionable item for community programs are to, have readily available pamphlets, phone numbers in your booklet, or maybe in your front entry or something like that, to like have those resources readily available so that people see those, so that people know where they are, and that can translate to real help, whether it's a physician or a therapist.
This is a great time to put in a plug for the amazing resources that we do have. Like, I feel like when we had our experience with Emily, perinatal mental health and therapists and other professionals being specifically trained was just kind of like starting to take off. And so we have amazing websites, especially here in Utah. We have PSI Utah. I think you'll have these like in your handouts somehow, and there's brochures out there. We have the Maternal Mental Health website through the state that is a directory where you can look up different professionals by area, location, insurance, all of these things. There are better resources. There are treatment centers now that are focused specifically on maternal mental health. I'll put a plug in for Serenity Recovery and Wellness that I work very closely with that are amazing at treating moms. So there are more resources. And then I would just add that I think from a community and especially a faith community perspective, I think as leaders, I know sometimes we can feel overwhelmed with all of the needs over those that we serve. And I would just remind you that like utilize your army, utilize your people, and that it's not about all of us being professionals, it's just about being present. And so looking at ways that you can utilize people within your communities to show up for those who are struggling. And it really looks like just a lot of hand-holding and being there and helping in the little daily things and showing up. But sometimes it's like, hey, I can do some research online and I can call some therapists for you. I can call some different offices and get some information. When people are in crisis mode, they are so overwhelmed. And so if there's an infrastructure in place in our families and in our faith communities where we can just step in and be present. We don't have to have the answers, but we can handhold and support a lot and take things off their plate that can help them through that process.
It's such a good insight, and I couldn't agree more. All of those resources which Megan touched on are on the table out there, our resource table. If you're facing the table, it's the far right end. And please take as many as you would like. It would be so great if we didn't have to bring any home with us. So, and there are more than what she mentioned. So, and so please take as many as you
May I
can.
mention really quick?
Go.
You can also check out the Emily Effect. We have a website, and like our role has been more to like make these stories real. I have Emily's story that I've done a video on. I've worked with a company to produce video stories of other women. There's written stories on there. Like that's what my website and social media pages are all about. It kind of takes it from like the clinical and being like, hey, look, here's some other moms and families who know what you're going through, and there's stories of hope and healing. So just keep that in mind, as well as like to refer moms to, because we want to bring them in and love them and connect with them in that way, aside even from just like the clinical and professional roles.
And that's another good point. Megan has all the good points today, but sharing, sometimes just connecting with people or getting them to open up is more effective by sharing those stories. So for example, going to the Emily Effect website, tapping into those stories and sharing it with someone, that could help someone open up much easier than just, hey, how are you doing? That seems to bring down barriers. So one last pause for the audience. Are there any questions? Anybody have any questions they'd like to ask or anything they'd like to share?
I just wanted to plug one more nationally available resource for moms and maternal mental health. The HRSA Maternal Mental Health Hotline, the national hotline. It's not a crisis line quite like 988, but it's staffed by trained counselors in maternal mental health specifically. So what you were saying, and they're available 24/7 and have translation into over 60 languages. So if you're wondering about that and you're wanting to pass that information on to community, I think the easiest way would be Google search maternal mental health national hotline. And it's like 1-833 TLC Mama is the line, but that's a good resource as well.
Thank
1-833 TLC Mama.
It's MAMA, right?
Yep, MAMA. Yeah.
Thank you so much. That's a great resource. Thank you. Any others?
I would like to know if Emily's Foundation, what are they doing on education and postvention? Postvention.
Sorry, education and what was that?
Postvention?
Post prevention,
No, postvention. POSVE.
prevention,
No,
postvention.
postvention.
Gotcha. I'm not familiar with that word.
So in suicide,
Yes.
I work for the American Foundation for Suicide Prevention. We have prevention, intervention, and postvention. Postvention is when someone dies to suicide, we never share the means or the method that the person used because it's contagious. It's called the Werther effect or the domino effect or the contagious effect. This is something that we teach all the time in the classes. So I'm wondering, Emily was sharing things about her sister, and I want to know what they are doing in postvention because sharing how someone died to suicide is contagious to other people. So that's why I'm wondering what you guys are doing, and also what are you guys doing with the community to teach classes, or if you have a class that we can send moms to or dads. I go to rural areas like Delta, Park City, and Camas and Fillmore. And for example, in Delta, you will see a lot of pregnant women, like tons of pregnant women, Peruvians. And then every time I see them, I tell them 80% of moms might have thoughts of suicide within when they're pregnant and after pregnancy, and even dads, because we don't talk about dads. That we get postpartum depression too. So I'm wondering what are you guys doing on education and then postvention in order to prevent the Werther effect, the contagious effect of sharing the method of how the person died to suicide.
Okay, hopefully, yeah, there's a few pieces there. Hopefully I answer this in the way that you're seeking for. The Emily effect is really just a way to bring the social awareness, and we, through our website, through the social media pages, spending a lot of our time, my personal time, actually, I'm the one doing it, is, posting about maternal mental health aspects and facts and taking care of yourself from my perspective as a therapist, right? So that education and awareness piece, and also through the things that we're doing with events and things like that. And these stories, like I mentioned, like for me, I've just,
might have thoughts of suicide when they're pregnant or after they're pregnant. That can be a key information for moms.
Right.
To spread, and then they can say, hey, I'm gonna go to your website and I wanna ask you questions as a therapist and get to know. That's what I'm wondering. Like, is there a based foundation on that? That's what I want to know because I have moms and I don't have a class at the American Foundation. I have one in English and Spanish.
Oh, okay. So you're wondering if through the awareness, if the Emily Effect organization is suggesting classes or if they have a class.
we do not have a class specifically. I do the education through social media posts and through these video stories that I've shared. Some of them are like a little bit more information, but most of them are story based. And then we have a resources section on our website that can like guide you to resources like this, like PSI Utah, or if I know of groups that are going on for moms, things like that, then I can post them on our resource page. Hopefully that we're kind of a landing base, the social, the awareness that way, but then referring to others in more of the professional aspect, if that makes sense.
Thank you for that question. Are there any others in the group? Oh, over here.
So sometimes faith leaders, when somebody's struggling with something like this, they may go to their faith leader for advice or counsel. At what point does that faith leader Like, how will they know, hey, this is beyond my ability to help? And they know that it's the right time to refer them to a mental health professional. And then a follow up to that is that, in my experience, I've also known people that are in a situation where they need help and they don't realize it. At what point do you force them into something or try to force them into something?
Two great questions.
I can, it's a good question. I think if you're thinking it, do it. Even if they don't need it or they don't see it, they may need it. So if that thought pops into your head, do it. Make the referral. Give them the information. Obviously, you can't force anyone to do anything. And I think to follow up the second question, now my clinical brain kind of turns on. If somebody is is a threat to themselves or others, you call 911. I mean, they can detain them essentially. I know that may seem drastic, but if you're feeling that they may imminently do something to harm themselves or others, I think that would be the appropriate response.
Courtney?
I think more to the second part. It just depends on how you approach the situation, because if I'm not in the right state and I don't know that and you tell me something's wrong with me, I'm just going to cycle that in my head, right? And then I'm probably going to react some other type of way. I think just the approach on it, all it is, ease into it softly. Hey, I've just noticed you're having a hard time. Is there anything I can do to help you? Would you like me to listen, or would you like my advice? Those are my two things. We're never going to get over everything. We can only get through it. So mainly just being there to support and just being like, hey, I can help you in any way. Am I going to be able to be like the one that's going to help you, or do we need to look for further resources? Just try not to come off and just go, hey, I think something's wrong with you. You're completely off. Some people don't react the right way, but it's okay.
And I want you to answer this too, but something she said that I think I'd like to highlight is when you listen to Courtney, when she talked about working with someone, she used partnering language, which is, hey, maybe we should look into this, or we could do that. Whereas the other approach would be, something's wrong with you. So there's a difference there. And that partnering language helps the person that's struggling know, hey, I'm on your team and I'm here for you, and we want to work together. So thank you for highlighting that.
Yeah, I think Courtney said it perfectly. I was along those same lines. It's just be as an observer, right? To say, I'm noticing that this is something that's been really hard for you a while, or things seem really overwhelming. Like, let's figure out a plan with that. What do you think would work? What do you feel like you need the most right now? But this we and this us and this let's language, right? And you can just point out things that you're noticing. And this, I can just imagine you're so overwhelmed, like those kind of things. And then again, doing some hand holding, and you can say, I don't know the answers. I did learn a couple things at this conference I just went to. Let's go look into that a little bit more. I know some people that we could talk to, but it's the hand holding, and it's not being a professional, it's being present. And that goes such a long way. And you're right, it's not your role to be the therapist, but when you are feeling that overwhelm, or you can see that this person has not been themselves for a while, or they're struggling more than they usually do, like, you don't have to go and Google and like find all the symptoms and all of those things. Like, follow your gut. And honestly, like, we all need extra help. We all need therapy and support at different times in our lives, and we don't have to wait until it's a crisis moment to do that. And we can convey it. Like, that's such a beautiful thing, I think, to teach people in our faith communities, right? Like, I think often what happens is we have this perspective of, if I just have enough faith and I pray and I do all these things, that it becomes about that, which that is a beautiful and of course very important part of this. But the way we heal is also by putting ourselves in a position to be healed. And people need to understand that, and they need support in doing that, and realizing, like, when stuff like this, when postpartum and things happen, there's a reason. And just like you would go to the doctor if you're having physical symptoms of any physical ailment, like, yeah, but pray and faith and do all of those things that are so important to get you into a place of healing, but then go do the work to heal. And I believe that that's how healing takes place. I believe that that's how God heals us, is when he uses those who have the ability to do that, when we put ourselves in a position to be healed.
Oh, I just wanted to put on the record, I don't condone pushing somebody into a corner and just calling 911, by the way. So.
Thank you for clarifying that. On that note, something that popped into my mind during this last question was I heard a faith leader say once that he shares with those that he's working with, I am a Sherpa walking with you. And I love that analogy. The sad thing is I don't remember the name of that faith leader, but I've never forgotten the analogy. And I think it's a good visual to think and ponder on as we're working with members of our community. Are there any more questions from the audience? We got time for one more.
I don't have a question. I just have a clarification about this last question. I'm Episcopalian, and in our faith tradition, we have clear guidelines about what we can and cannot do with people who come to us. We have a limit of 3 times that we can meet with someone on the same issue. Once a parishioner has come to you 3 times and they're stuck in the same place, it is your moral obligation to refer them to a mental health specialist. We are faith leaders. We are not therapists. We are not psychologists. We need to have the humility to recognize where we are limited and where further support is needed. So that's just a reminder that we're not supposed to be everything for our people. We are just part of a team that gets to support people, and we need to be aware of what we can and cannot do.
Such a good thought. Thank you. On that, we'll wrap up our panel. Please join me one more time to thanking our panelists.